And welcome back. It's now 8 minutes after 8. This is Morning Express. And today being Wednesday, we also like to focus on matters health. Now, of course, COVID-19 has been a subject of discussion for a long time. But right now in Kenya, one of the things that we're considering to do is to open up the economy in various ways. That is by way of opening up borders and ensuring that people are able to move from one county to another. But then there is the risk that is carried by that cross-infection of COVID-19, which right now we, according to details that were given by Ministry of Health, is still on the increase. So the question is, what measures do we need to put in place to ensure that we do not get to a point where we cannot control this disease? Now, one of the proposals that has been given is having an infectious disease hospital, which we do not have in Kenya. I believe Mbagathi Hospital at some point was meant to be one, but once it was handed to the Nairobi County government, that was not the case. When we look at countries like Singapore, they seem to have adopted that. So the question is, do we need to be looking in that direction as we see how to control and ensure that we control COVID-19, not just COVID-19, but any other infection that may come? What lessons are we learning from an infectious disease like COVID-19? Now, to have this conversation this morning, I am joined by Alfred Obengo, who is the president of National Nurses Association of Kenya via video link. Good morning, and thank you for joining us, Alfred. We're also joined by Michael Gitau Kongo, who is an infectious and prevention and control specialist, also joining us this morning to have this discussion. So allow me to start with you, Alfred, with that particular aspect of an infectious disease hospital. Is that considered best practice? When we look at countries like Singapore, would we consider that as best practice?
Definitely, Michael. Thank you first for having me this conversation. Definitely, that will have been the way to go, and that's why the colonial government left with us the infectious disease hospital at Mbagathi. In any healthcare setup, healthcare environment, we expect mutating viruses and bacteria, and these pandemics and epidemics are usually the normal phenomenon of the day. That's why we need an established infectious disease hospital, not just in Nairobi, but we've suggested that we will build them across within the former 8 provinces. That will have been the way to go. But along the way, we also converted Mbagathi Hospital to just any other hospital like any other. It's like we are oblivious of the fact that one day we'll be hit by an infectious disease of this magnitude. So that's a mistake that we did in the first place. We could have actually built the capacity of Mbagathi as an infectious disease unit and open up other units within our provinces, probably the counties as we speak today.
An infectious disease hospital. Are we talking about a department within a hospital that purely deals with infectious diseases, or are we talking about a hospital that is completely separate from others that deals with infections?
We are talking about a special hospital that just deal with infectious diseases. Mm-hmm. And I'm happy you touched on Singapore. Singapore is an example of a country which has managed to have minimal infections, minimal death, in fact, insofar as health workers are concerned, because of effective infection control measures that were instituted in that country. And that is what we are lacking within our environment. Definitely, COVID got us with our pants down, but it's also an opportunity to reassess our health systems, our public health system. Mm. How do we strengthen our health system? Okay. And specifically, we must have infectious disease units. We could not have panicked as we have panicked today. As we have panicked today.
And we'll look at the benefits of that in just a bit. But let me bring in Mr. Gitau. Your thoughts on this. Do we need an infectious disease hospital?
Yes, of course, we need an infectious disease hospital, because if you look at the population, what we have, if you just talk about a unit is just one of the departments in a hospital. So, and if you look at the infectious disease hospital on its own, what does it bring about? There's different pillars that it comes with. One of them is you have the clinical services, you have the public health, you have social science, and you also have to engage with, there is research, there is a training and education, and there is now community engagement. So those pillars, as you look at them, so you cannot have that in one department, because for pandemics, no any government, no one in the whole world that is ever ready for it. So what you end up having is like in a spill like what we're having currently. If you do not prepare for that, then all the time you're going to get up and down. Now, even the first world countries, as you could, maybe you have just given examples, they have not fully fledged and say that they are sufficient enough. So they are still rebuilding. If you look at Singapore, they only have 300 bed capacity. So if you look at the population within that nation, is it efficient? So because, well, pandemic could change. Right now you're talking about coronavirus. The next thing you could be talking about something else. So you realize at the end of the day, and we still have the ongoing problems that we have within within different nations. So yes, it is very important, and more so I could anchor that, and more so because when you're looking at infectious disease, then there is another anchor of infection prevention and control, which is now the biggest part, again, subsect. And this is what now, it is anchored on what? It is a scientific, and again brings about the practical solutions to the to the mainstream at that particular moment. So this is what you're looking at. Do we really need it? Yes, we do need it.
Okay. Alfred Obengo, maybe let me come back to you. And we might be sitting in a position where we are sort of waiting with bated breath for that announcement from the Ministry of Health to say that now we are clear and we can, you know, go back to our normal lives. Is that something that we should be waiting for, or have we been passed by events? In short, is that maybe something that's not going to happen?
Remember, COVID has brought down the most sophisticated healthcare systems in the world, the strongest, which actually you can't even compare to ours. So it is something that, for me, I've always said that we should approach it with a lot of caution and not the normal PR stance that we are used to. So, and coming to whether we are going to probably lessen or ease our restrictions, I think the political government is torn between the resuscitating the economy and also maintaining and sustaining the health and infection control measures. So juggling the two, I think, is a very big headache for the political establishment. But as we've said also earlier, is that these are war that we must come together and share ideas. And the biggest objective here is to ensure that we have minimum casualties as much as possible. So it's a very delicate decision, I agree, on part of the government that has to make, because also you can't also sustain the health of Kenyans without a collapsing economy. But we should still maintain those measures that actually ensures that our citizens are protected.
Do you see us having a situation where we are all clear and go back, as it were, to our normal lives?
As it were, if you are to go back to our normal life, that will be a very big risk, because as we have very weak systems. In fact, even if we are to go back to our healthcare system insofar as the health workers situation, we don't even have system and whereby we can monitor individual health workers who are working in those specific infectious disease units. So we have very weak systems which people have first looked at. It may not even, it could not have protected a day or two, maybe a longer time, but it's a very risky decision insofar as just opening fully the economy.
The economy. All right, Mr. Gitau, do you see us returning to a point where, and when I say returning to a point, I mean, do you see ourselves going back to where we were before COVID? You know, where we could just literally just go about our activities without necessarily too worried about an infectious disease. You know, before the only infectious disease we were worried about was flus, which we already had cures for. Do you see us going back to that as a normal life?
Well, going back to life again, to what we used to be, might not come as soon. Why? Because if you're looking at the setup of what we're having with coronavirus currently, is that it keep on changing. Now, we have had other countries even trying to reopen back again, and now we're having again an oversurge, which is our infection rates, which they end up closing back. So this is something that we need to adapt. And one of the things that I'm finding I'm liking is that some of the measures that have been put into place by the MOH, Ministry of Health, across other departments again, and more so because it's an issue as well to the public health and also the medical services. And you remember then again, it is anchored again to the Big Four agenda, which again the president was quite passionate about, is that as long as we follow the simple measures that are put into place, then we can always now reopen and start, not necessarily now going back to when, because the issue of cases of the social distance is going to be part and parcel, the hygiene, the hand sanitizing, and again we don't need against the cases of close down, because until we find out what is where this problem came from, which is meaning getting perhaps either vaccination or a cure of this disease, then you may not end up going back again to the normal setup we had. Right. But it's just to adapt and going back to the same. Okay. So this means now we have to, just to acquire this and trying to get it into another, to go in another, another line of kind of now life, that again, once we adapt these, it becomes easier as well, because it means we can manage this virus as well.
All right. Coming back to you, Alfred, what advantages are we likely to have if we have an infectious disease hospital? And while asking that question, there's an article here on page 8 of the Standard this morning, flu virus with pandemic potential found in China. And it says a new strain of flu that has the potential to become a pandemic has been identified in China by scientists. And that's why I was asking whether we'll ever go back to normal, because even if we flattened the curve for COVID-19, it seems to me that infections are something that we'll have to deal with from here moving forward.
One of the functions of an infectious disease hospital is actually to build an IPC system, that is infectious prevention control system, that provides 100% protection of accusation of hospital-acquired diseases. What you're talking about that is having an established infectious disease hospital actually helps to mitigate, helps in preparedness insofar as these pandemics and epidemics are concerned. You cannot actually compare a situation whereby you have a strictly infectious disease hospitals, probably, let's say just even if there are 8 across the country, and a situation where we have none. It is totally different scenario, because the infectious disease hospitals help us also builds on our preparedness. It enhances our ability to prepare adequately for any eventuality insofar as an outbreak of infectious disease are concerned.
All right, and maybe coming to you, Mr. Gitau, question being, what are some of the advantages we are likely to see with an infectious disease hospital, and specifically in terms of dealing with infections? Because where we are now, we are playing catch up. We have hospitals that are trying to, deal with some of these infectious diseases, but are not well equipped. Would this put us in a position where we are able to deal with it quickly and effectively?
If you remember what I talked about earlier on, one of the pillars we find in infectious disease, one of them, apart from offering the clinical services, is research. And the research, you have found that we have people now who are already coming to innovation. Look at the case where we had students innovating even defibrillators, respirators, or fields of the ventilators. So that gives us another point where now it gives us another point of growth. Then we have the case of the PPEs that are being made locally. This is a face mask, goggles, the gowns, the aprons, the shoe covers. That gives us an advantage again of what has brought in, because this is an invention that we never look into it. Then also there are points where having that, there is a sensitization that most of, especially everyone now need to remember to hand sanitize, then ensure there is issues of the social distancing. Some diseases, again, they're actually going lower in terms of within the country. So that, again, it's alleviating a little bit of a problem to the healthcare system. So because now, remember, the healthcare system currently is overly burdened already. So with these kind of innovations that are coming into place, remember, they are geared in because of what we are having currently. Then there's some of the proposals that are being put into place, and again, we are adapting in different areas and other countries what they are doing. So these, again, bring us to a good position as well. I know that, again, there is a case of where now we are losing life. And as much as we're losing, and my condolences to the lost, for those who have lost family members. But now, at the same point, it gives us another advantage that we see, all right? There is a link that we have not been looking into. Look at the systems that we have earlier on we used to create. And this, most of the time, it is talking about infectious disease as a hospital. Do we necessarily need it only at the main, the national government or within one region, or do we need it across the, do we need other facilities across the country? Because if you look at the population that we have, obviously, one hospital would not be enough. That cannot be enough. Then we are looking at the healthcare practitioners as well. So these will be now, again, we need to train more healthcare providers and in respect to respond to infectious diseases, because this is just not going to be a normal case when you respond just to normal clinical services. So that brings us to another point. And that's why I say, like, for example, what was President said that we're going to recruit more healthcare providers. That is a very good point. And I would want that to grow, because as part of his legacy is, again, to have these, as long as we can have a health system that is running for anyone who is top or to the common person, then that makes even the country grow on a better platform.
All right, and as we get to the tail end of this conversation, Alfred, frontline workers, of course, are also doing their best, but putting themselves at risk, but also putting the communities at risk. How do we mitigate that and ensure that as we deal with infections, we are able to give them a safe space to work, but at the same time protect the communities and their families?
Thank you, Mike. We said from the outset when this pandemic broke out that if you don't protect the healthcare workers, the frontline warriors, then you're actually exposing the whole community to this virus. So the protection of the frontline workers is paramount, and we cannot actually overemphasize that fact. So far, we've tried to, so far as provision of PPEs and training is concerned, but it's still not adequate. We need to move very fast and ensure that our healthcare providers are protected. Actually, I'm seeing so many pictures from the governors published in our mainstream media about very beautiful isolation center. This must be accompanied by workers, because buildings will not nurse patients. It is health workers who are going to nurse the patients who are going to be admitted in those hospitals. It must be accompanied by skilled, competent, and well-trained healthcare workers at the same time when you are seeing those beautiful buildings. So as we are talking now, we need to move, emphasize on the issue of moving from theory to practice. There are so many theories that we are talking about which you've not put in practice. So we need to get down, roll down our sleeves and go to the ground. As we famously say in Kenya, that ground is iko tofauti. We speak so well in Nairobi in conferences, but on the ground, there's our health workers actually are rewinding things like simple things like face masks. You find one health worker putting a face mask for almost 1 week, which is actually very, very dangerous insofar as infection control measures are concerned.
And maybe,
so we need to invest more. We need to invest more on the health workers and their protection.
Okay, maybe tell us a little bit about negative pressure wards. What would those be and how would those help?
Come again?
Tell us a little bit about negative pressure wards.
Yeah, there's a lot of pressure, though I've not gotten that question rightly, but there's a lot of pressure insofar as handling the situation is concerned, specifically the COVID pandemic. There's the issues of physical, psychological, and even emotional pressure that we are going through, because this is actually a disease that came with a lot of scaremongering narratives. So the stigma is there. We are having health workers who are going back home and cannot mingle with their family normally as they used to. They can't mingle with their colleagues as they used to. So there's a lot of pressure insofar as added more pressure insofar as our working environment is concerned.
All right, Mr. Gitao, as we wind up, your thoughts on what we need to do, particularly for those frontline warriors, to ensure that they're able to work, because with infectious diseases, we need them, to be in the front line, but at the same time, we need to protect them and their families.
Well, I'll mention just a few. One of the things that, again, as my colleague has just talked about, is we're looking into their working area, and that means the medical facilities, and again, we also have the patient safety. So the thing that they need also, we need to work hard on them is provision, and meaning this, we also have the management structure need to be changed, because what we're dealing with is not what we have been dealing with. Remember, they're working for long hours, and this is a case where you're bending from a pre-hospital side all the way to the in-hospital side. So that, again, it's a holistic system that needs to be bent together that can work as one. And when they're working in, it doesn't matter whether they're working in an ambulance service with the ground ambulances or the air ambulances or the part who are working in a hospital setup. They're all at the same time a front line. So whatever you provide for both, that means the case of the PPEs, it should be standardized, because the problem we're finding at some point is we're having the PPEs that are not standardized. And when you're talking about dealing with the case of the infectious diseases, it's either yourself you get exposed now, you take it back now to the family, or you spread it to the rest of your colleagues, which now it becomes a bigger problem. The other thing that would be, again, also to be looked into is a little bit of engineering controls. Some structures are not suitable where we're trying to squeeze in and then the workers to work in. For example, you just mentioned about the negative pressure units or the wards. That is an institute that really takes a lot, because whatever happened, the environment that it's outside and what it is inside, they are totally different. So even for those who are working in there, what is the shift pattern? How long can they work there? For how many hours? Then they need to keep on donning, that is putting on PPEs and removing the PPEs. Who are overseeing them? So should again they get exposed, then which facility are they going to be taken to? And who is to cater for the bills? Then you remember again, even their families, compensations comes in, because some points they may end up losing even their lives. So I think the point here is, again, those controls need to be harmonized all together. And at the end of the day, again, to sensitize as well to the family members what these people are going through as well. And so it is a joined up service that at the end of the day, if we can do all that, then we will come to realize what is now the universal health, quality health, universal health coverage.
For all and sundry.
Yes,
all right, Alfred
all.
Obengo, your closing remarks as we wind up.
Salute all the health workers in Kenya for their dedication, their commitment, despite the challenges that we are going through. We have not even seen the welfare package that was promised by the president, but we are still out there fighting on behalf of this country. I want to salute them for their patriotism. They have actually exemplified extreme patriotism than no one else at this time. And then I want to also wish all nurses and midwives a happy 2020. This is your year. When WHO declared this year to the year of the nurse, they didn't know that we shall be practically nursing the world back to health. And we are actually doing that with a lot of commitment, passion, and competence. I salute you, all health workers. Eko, hongera, asanteni sana kwa kazi mzuri.
Thank you very much. Alfred Obengo, President, National Nurses Association of Kenya, and Mr. Michael Gitao Kongo, who is an infectious disease prevention and control specialist. Thank you for joining us this morning to have this conversation on whether we need infectious disease hospitals moving forward. It is now 8:30. We're going to take a short break right here on Morning Express, and we continue after the break with international news. Do stay with us.